Namaste. Good morning, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste. Sir, today we'll continue with the women's difficulties, challenges, and what about premenstrual syndrome? That would be a good topic.
See, every month female menstruates. The physiology indicates that there would be ovulation, and if the ovulation fails to conceive, there would be a menstrual flow, which discards the preparation in the uterus for receiving the zygote. Now, there are a lot of hormonal changes occurring because of this menstruation, because every month the ovum has to become matured, it has to be released, and that ovum is attracted to uterus for fertilization, and if things go well, the sperm reaches, it gets fertilized. So every month potentially the female or organs prepare themselves to receive and that whatever preparation is there, that is desquamated or cleared when it fails to conceive. So with these processes, there are a lot of hormonal changes occurring, with the presumption that if zygote gets conceived or comes in uterus, it has to be harbored well. So many females, they get low backache because that bearing down comes. So few females get it one day earlier, few females get it 2 days earlier, and even breast tenderness would be there, even the mood swings will be there, even there would be sort of a what we call a depression before period, and vague body ache. So each female will have different symptoms. We have seen one female gets a sore throat, ulcers in mouth. Few females get constipation as a premenstrual syndrome. Few females just get mood swings. So these things are very common, but at the same time, if they are in a physiological degree, what we can call within pain threshold, then there no treatment is required. Even female herself is aware of this, that maybe the menstruation is occurring, and of course it depends upon the sensitivity of the female also. If they are more sensitive, they are more aware of this, and once they understand that this is because of premenstrual syndrome, and then they overcome it and they cope with it. Many times we have treated cases where the female herself doesn't realize that it is premenstrual syndrome, and the family members also don't understand it. Sometimes there are action and reaction, and they go into vicious circle every month. But as such, if it is in a milder form, it does not require any treatment. And homeopathy has wonderful remedies, and very common remedy is lachesis. Lachesis, then pulsatilla is a plant, lachesis is a snake poison. So these remedies do help female to overcome the intensity of premenstrual syndrome. But like pimples, acne pimples, they are very common in females, in adolescent girls. As a premenstrual syndrome, they get pimples, and that too in a symmetrical order, and they can say that now it's time to menstruate.
What kind of age range? From what to what?
Right from puberty, from
puberty?
12 plus to even till attaining menopause, you get symptoms. And not only that, these symptoms would even get altered. Like we have seen some females, they get breast tenderness as premenstrual syndrome, where later on they start getting mood swings, and sometimes they start developing constipation. So even the nature of symptoms also would change. and some people they get severe pain. But there is one variety what we call a primary dysmenorrhea. Primary dysmenorrhea is where the sensitive females they start getting very extremely painful menstruation, and that starts about 18 to 24 hours earlier, and they get severe pain. But this primary dysmenorrhea in 99% cases disappears with conception, the first conception, and later the female doesn't have dysmenorrhea. But premenstrual syndrome is very, very common in females.
Thank you so much.